Hi everyone, my name is Felix. Oh, welcome to week four uh, of our psychological testing. Week four of psychological testing. For this week, our focus shall be cultural and contextual considerations, cross-cultural testing, indigenous and faith-sensitive assessment issues. Those are things we are going to be considering for this week. Cultural and contextual consideration. So, with specific area to focus. I hope you are enjoying the first 3 weeks we've had, and I believe you are going to enjoy the fourth week also. Let me start by saying that psychological testing does not occur in a cultural vacuum. In pastoral counseling, assessments are conducted within a rich context of culture, rich context of faith, rich context of worldview, rich context of language, and lived experience. Please don't forget that this lecture explores how culture and context shape the meaning, validity, and of course, ethical use of psychological tests, especially when working with diverse indigenous and faith-based populations. Please, you need to understand that these two contexts are very important factors to be put into consideration whenever you are doing psychological testing. Culture and context are very important. Now, our learning objective for this week is this. You must be able to explain the concept of cross-cultural testing and its challenges. Number two, you must be able to identify sources of cultural bias in psychological assessments. Then number three, you must be able to discuss ethical issues in testing, you know, people of diverse population. And you must be able to apply faith-sensitive approaches to psychological assessments in pastoral counseling. And the last one, you know, you must be able to integrate cultural humility and theological sensitivity into assessment practice. Okay, so let's start with cultural cross-cultural testing. Cross-cultural. When we say cross-cultural, what are we talking about? Cross-cultural. What are we talking about? Now, cross-cultural testing involves adapting, administrating, and interpreting standardized assessments to ensure they are valid, reliable, and free from bias across diverse culture or linguistic population. Let me take that again. Cross-cultural testing involves adapting, administrating, and interpreting standardized assessments, such as intelligence uh, assessment, personality, skills, aptitude, and all that, mental health. So the reason is to ensure they are valid, reliable, and free from bias across diverse culture or linguistic population. Now, cross-cultural testing refers to the use of this psychological assessment with individuals whose cultural background differs from the population on which the test was developed and not. Let me tell you this now. Every standardized format came from the West, that is, from Obodo Yibo. When they were making those standardized formats, those who made it across the culture of the West. So you see a reflection of the Westerns in those assessment formats. So now, if you want to use the same format, testing tool, test tool, if you want to use it in Africa, so there is a need for you to put into consideration cultural background of the population you want to test. So if you want to, for example, you want to test depression or anxiety, the way you will use it for the Westerners, you can't use it like that for African man who came from Lagos. That's what we are trying to say. Okay, you are assessing an individual whose cultural background differs from the population of which the test was developed and normed. So it was normed and developed for the Westerns, but now we are using it in Lagos. So it means you need to put some culture into consideration when you are doing that. Otherwise, you'll be making a lot of errors when you are doing your result will full of error. You can never be balanced. Your result can never be balanced. All right. So most standardized psychological tests were developed in West, educated, industrialized, rich, and democratic context. Okay, which raises concern about their universal applicability. So when it comes to universal applicability, you can't just use it for a typical Igbo man or Yoruba man or Hausa man in Nigeria or in other part of Africa and believe that you will arrive on the same result with the Westerners. Don't forget the result was not originally meant or made for them. That is what we are trying to talk about when we're talking about cross-cultural testing. So a lot of factors you must put into consideration when you are bringing the format, the testing tool made in the Western countries or part of the world, you're bringing it to African context to come and use it. You have to put into consideration the culture of the people, the religion of the people, the faith of the people, and so many other factors like that. That's what we are trying to explain there. Let's look at the sources of cultural bias. Sources of cultural bias. When we talk about cultural bias, we are simply saying that the unconscious or conscious tendency to judge, to interpret, to evaluate behaviors, to evaluate people or situation based on the standards, value, and norms of one's own culture. Like, look at me now as a therapist, mental health therapist, and registered psychotherapist. When I'm using any of the standardized tests, when I'm using it with the Westerners, who is a typical white or Caucasian, I have to be very, very careful of my cultural bias. I have to be very, very. So if I don't put that into consideration, it is called cultural bias. So it's an unconscious or conscious tendency. All of us have it. That tendency to judge or interpret or evaluate people based on our own culture. When somebody is saying, "Oh, this is happening to me," I must not be rationalizing it with my own culture. What are you talking about? This is a small thing now. Why are you taking it serious? When you are saying that, that's cultural bias. Okay? So there are three types of that cultural bias. We have construct bias. The psychological traits being measured may not exist or may be expressed differently across cultures. may be expressed differently across culture. Construct bias. Number two, method bias. Differences in testing conditions, familiarity with testing formats, language proficiency or examiner, client relationship, method biases. So all those, that's another type. That's the sources where you know biases can come from. Now, I want to conduct a test for a white or a Caucasian man or a woman. Looking at me now, you know, if care is not taken, we create a bias on its own. Just looking at me, how can a black man test me? Is he capable of doing this? Can he do that? Is he sufficient? Can I trust whatever test or result is given to me? So it's a form of bias. Okay. We have item bias also. That's number three. Item bias. Test items may rely on culturally specific knowledge, values, or expresses unfamiliar to the client. Okay. If I'm using some tools, some test tools that the client is not familiar with, or some values that the client is not familiar with in the in the content of what I wanted to use to test. So that also can create a bias. Don't forget the three types of bias: construct bias, method bias, and item bias. Implication for pastoral counseling. What is the implications? In pastoral setting, cultural bias can lead to misdiagnosis. Number two, pathologizing normal cultural or religious behavior. Okay, I've seen people telling me that when you want to use spirituality to address every issue, it's a mental health issue. I've had people pathologizing normal cultural or religious behavior. Number three, loss of trust between the counselor and client. Okay, the counselor may not trust the client may not trust the counselor. That's the implication of pastoral counseling. Some of us who are in this part of the world, we are experiencing a lot of all these things. Number four is ethical and pastoral harm. It may cause harm. Okay, don't forget that globalization is the order of the day now. Globalization, immigration are taking place. So some of the people you'll be coming across anywhere in the world may not be people from your culture whom you may need to attend to. And that is the implication that we have to be very, very careful when you are working with them. You must avoid, you know, cultural bias in supporting them. That is very, very important. Okay, let's look at this briefly for the sake of those of you who may be coming to the western part of the world to work later on or any part of the world. Let's look at the indigenous assessment issue, historical and ethical context. That's number one. Indigenous communities, there are people that are called indigenous community. That happens so much in other parts of the world where you have the people who are the original owner of the land. But due to colonization and globalization and all that, people came immigration and they took over the land from the original owner and develop it and open up the land. Okay. What is the historical and ethical context to this? Colonization and cultural suppression. They have experienced colonization and cultural suppression. Even back in Africa, we have experienced colonization at the time. Before the withdrawal, before we gain independence, a lot of things were happening when we have the British everywhere in Nigeria, in the helm of affairs, in the north, in the east, in the west. We have them everywhere. Okay, but in the west, we have indigenous community who have experienced colonization and cultural suppression too. Number two, forced assimilation and residential school trauma. I don't know, some of you, if you have read about indigenous story in this part in the West, you notice that there was a time when they were forced to integrate into Western culture. They were forced to drop their own culture and imbibe the culture of their colonial master. And during that time, many were withdrawn, children were withdrawn to be taken to residential school, and many of them died there. Many of them experienced a lot of trauma, and it became generational trauma for so many people. So, for those people, when you are testing them, when you are using all this testing material for them, if care is not taken, you're not going to get any accurate results because there's no trust because of their history, because of the trauma they have experienced. And number three is misuse of psychological and science to justify the oppression. Misuse of psychological science to justify oppression. So if care is not taken, you'll be justifying the trauma they have went through, you've gone through. You will be justifying it. So when you are working with them, you have to be ethical. You have to, do everything we talked about last week. You must be harmless. You must have goodwill of people in your heart. You must be sincere. I know that we talked about ethical uh, consideration last week. So these are things that are happening. So as a result, psychological testing may be viewed with suspicion or mistrust. Until today, that is where we have a lot of stigma around mental health. When you are testing people, people don't trust you. People don't want to be labeled. People don't want to be diagnosed. Everybody's running away from tests. They just want to deal with the symptoms. So if care is not taken, you just notice that there will be a lot of suspiciousness and mistrust in that. What are the limitations of standardized tests? Limitations of standardized tests. One, norms rarely include indigenous population. Or number two, Western concept of self, mental health, and pathology may conflict with indigenous worldview. Because what you are calling a sickness or mental health illness may not be for them. That's why you need to understand the people you are dealing with in our context. You need to understand the people you are dealing with before you continue with whatever you want to do. Individualistic assumption, they clash with communal identity. In the West here, it is individualistic culture they have. Everybody's just doing their own thing. You can't, nothing concerns you about my children. You can't rebuke my children. I can't rebuke your children. We may be neighbor, we may not be talking. But back in Africa and some part of Europe, we have a lot of communal identity. We do things in common. I can help you, you can help me. If I don't have soup, I can come to your house and take soup. You can support me, I can support you. We do things in common. So we need to understand the context where the person we are dealing with is coming from. Otherwise, we may lose them. Culturally respectful approaches. So pastoral counselors should practice cultural humility, not cultural expertise. For example, if you are an Igbo man who want to test a Yoruba man and you don't understand where the man is coming from, there's a need for you to express cultural humility. That is, you are open to learn. You are open to learn, and vice versa. Maybe you are Yoruba man, you want to test an Igbo man or Hausa man. You need to exercise cultural humility, not cultural expertise. This is very important. Don't prove to know everything about their culture. You need to listen to them and hear them out. Number two, you need to engage community knowledge where appropriate. What happens in their community? What is the norms of their community? What is the culture of their community? What's going on there? All right, you need to engage community knowledge where appropriate. Number three, you need to use narrative, relational, and strength-based approaches. Use narrative, relational, coming down to people's level. You are not making it your idea, everything your idea, you need to make it relational, you know, and strength-based approach. Okay, that is, it's coming from the client. It's not about you. It's about our client, not all about us. And last one there is that we need to recognize spirituality, land, ancestry, and community as integral to well-being. This is very. I've met a lot of clients that comes to the session with me who begin to talk about how they draw support from their beliefs, their culture, where they are coming from, their community. All I need to do is to listen to them and use what they are bringing in to support. I'm not imposing what I know on them. I'm using their spirituality. I'm using land. Their, what's my understanding, and they want to share with me. I'm using that to administer whatever I want to administer to them. And this is very important. Now, maybe we don't know. Some of you may not know that the definition of spirituality in the Western culture sometimes different from the definition of spirituality in Africa or some parts of Europe. People have different, definition of spirituality. You know, people can draw their spirituality from nature, from, you know, anything. It's not only about the God you believe in. That's why you have to be open to understand the client you are dealing with. So, nothing about us without us. Assessment should involve collaboration, should involve consent and respect. Please don't forget this three. Assessment should involve collaboration, consent, and respect. Nothing about us without us. Let's look at the faith sensitive assessment in pastoral counseling. Faith as a context, not a pathology. Faith is not a sickness, it's not an illness, it's a context. And we must understand that religious belief and practices are often protective factor for so many people. In fact, a lot of researches have proven that religious beliefs have been a source of protection and resilience for so many people who are going through a lot of issues today in their life and their mental health. Religious beliefs and practices shape coping styles, meaning making, and moral frameworks of so many people. That's why we need to understand their faith context, where they are coming from, and help them to form a coping tools and mechanism from their faith. Religious belief and practices should not be mistaken for psychopathology, the sickness of the brain. That's what many people are calling it today. When you see people saying some spiritual thing, somebody introduced a client to me sometimes ago that the client was just, the client is a Christian, and he has a lot of biblical knowledge, and everybody can understand what the family member, all of them cannot understand what she was saying because it came from a deeply rooted Christian background from Europe. He was saying a lot of spiritual things that people around her and previous counselor could not understand what he was saying. And that's how they transferred that client to me. I was with this client, we were talking for an hour, and I was able to connect with her, and we understood ourselves. When we finished the session, she was asking to talk to me again and again because I was able to understand what all the spiritual things he was saying. I was able to connect at the same level of our spirituality, biblically and spiritually. She was saying a lot of revelations and all things that she saw, and I was able to connect with what she was saying. So, for example, fasting, client is talking about fasting, talking about prayer, is talking about vigil, talking about speaking in tongues, or strong moral conviction. We must understand this within theological and denominational context. You need to understand their belief about God, their perspective about God, and what denomination they belong to. This is very important. So when during assessment, when you are doing the first assessment, you need to collect all this information about your client to know, what is it all about when you have a session, a counseling session with them. So this is very, 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 very important. Otherwise, you won't connect with them and you will not be able to sustain therapeutic relationship, which is essential for the recovery of our clients. Let's look at integrating faith sensitivity. Faith sensitivity assessment involves asking how faith influences distress and healing. Okay, this is the belief of so many people. So you need to understand how faith influences distress and healing. You need to understand spiritual language used by the client. That's what I was saying the other time. Distinguish spiritual experiences from clinical symptoms. We must be able to do this. And respecting doctrinal differences. Your client may not have the same, you know, doctrinal belief with you. You need to come down to their level. It's not all about you, it's all about your client and understand what they are trying to say. So, psychological tests should be supplemented with clinical interviews, spiritual histories, and pastoral discernment. Psychological tests should be supplemented with clinical interviews, spiritual histories, and pastoral discernment. Ethical balance. So, pastoral counselors must balance professional psychological standards. Okay, you don't have to throw that away. You have to put that into consideration. Number two, must balance pastoral responsibility. You are not just a professional. You are a spiritual man and you're a pastoral ministry. So you have responsibility. And number three, pastoral counselor must balance by respecting religious freedom and of course avoidance of spiritual coercion or theological imposition. You are not coercing your client and you are not imposing your faith on them. This is very, very important. So what are the practical guidelines for pastoral counselor? Practical guidelines for pastoral counselor. Number one, never rely on test scores alone. Never rely on test scores alone. Number two, ask culturally informed questions during interpretation. Ask culturally informed questions during interpretation. Number three, be transparent about text limitation. Be transparent about text limitation. Okay. Number four, consult cultural and spiritual resources when uncertain. Don't assume, don't jump into conclusion. When it is not clear, it is not clear. Seek support. Okay. Consult cultural and spiritual resources when uncertain. Number five, document cultural consideration in assessment report. Whatever culture you put into consideration in whatever you have done, you need to note them in the report. And number six, you need to maintain ongoing self-reflection about your personal biases. It's progressive, reflecting on yourself to understand your own personal biases. Let me give you a sample of that. Let me give you an example of that. Sometimes when somebody, at the early part of my practice, when somebody comes and begin to describe their problems, the first thing that comes to my mind is that I just remember back at home, many people are going through this kind of problem and they are fine. You can't even see it in their faces. Why are you taking it so serious as if it's a big deal? But with time, that's my part. I was able to identify my personal biases. That don't forget these people are not from Africa. Don't forget that you have to be objective. It's their feelings, not your feeling. It's not all about you. It's all about them. It is what people call it. That is what it is. It's not about what you are calling it. It is what if it is painful for them, it is painful. You don't have to say it shouldn't be painful as much as that. People have a problem, they have a problem. You can't say why can they how can they have problem? So we need to understand as we grow in our profession, in our pastoral work, whatever you are doing, you have to do a lot of self-reflection and of course some personal biases. This is very, very important. So that's that for what we have for this week. Week 4, cultural and contextual considerations in psychological testing for pastoral counseling. In the secular, it's a different thing. But when you bring in culture, faith, culture, spiritual background, when you bring all this into it, it becomes a different thing entirely. By the time you read the text for this week, I hope you'll be able to join everything together and have full understanding of what we are talking about in the week 4. If you have any question or concern, please feel free to reach out to me. Okay? And I will talk to you again next time. Take care and enjoy the